Hello everyone, today we will discuss one of the very important topic in pharmacology, that is fixed dose combination, which is commonly asked in MBBS exam as well as commonly asked in NEET PG exam in the form of MCQ. So let us discuss fixed dose combination in today's video. So let us first discuss about the definition of fixed dose combination. Combination of two or more active drugs in a single pharmaceutical formulation is known as fixed dose combination. Remember, it's a fixed dose. So here you cannot adjust the dose of the drug. So this is the limitation of fixed dose combination. So remember, there should be at least two drugs in a single formulation. For example, it can be in the form of tablet, it can be in the form of capsule, anything it can be. Now let us discuss about the criteria for prescribing fixed dose combination to the patient. So first criteria is patient requires all the drugs in the preparation. That is the first criteria for FDC prescription. Doses are appropriate and do not need to be adjusted separately, and it corresponds to the need of individual patient. That is the second criteria. Next is the drugs combined should achieve a better therapeutic response than either drug alone. So it should be effective. The efficacy of this combination should be superior than the single drug alone. It should also improve the compliance of a patient, and at the same time it should be safe for the patient. So these are the criteria for prescribing fixed dose combinations. Now let us discuss about the advantages of the FDC. So first advantage is enhanced effect, which is also known as additive effect or synergistic effect of the drug. Now let us understand this with the help of one example. Levodopa, which is combined with the carbidopa in the treatment of the Parkinsonism, and it is having a pharmacokinetic advantage. Carbidopa, it increases the bioavailability of dopamine in the brain. Carbidopa also decreases the dose of the levodopa, and it also decreases the side effect of levodopa, which occurs in the periphery, which are nausea, vomiting, orthostatic hypotension or cardiac arrhythmia. This type of the side effect also decreases. So this is having a pharmacokinetic advantage. And so this is a rational FDC. Now next is amoxicillin, which is combined with the clavulanic acid. It is having pharmacodynamic advantage. Clavulanic acid increases the antimicrobial spectrum by covering beta-lactamase producing organism. So this is a synergistic combination, and this is also rational FDC. Now isoniazid plus rifampicin plus pyrazinamide, it is having a therapeutic advantage which is prescribed in the treatment of the tuberculosis. So this combination acts on the tubercle bacilli which is present intracellular, macrophages and persisters. This combination also delays the development of the drug resistance. So this combination delays the development of drug resistance. So this is also rational FDC. Now another advantage of FDC is minimization of the unwanted effect. So when you give FDC, side effects of one drug can be minimized. For example, spironolactone, which is combined with the furosemide, potassium loss which is caused by furosemide, that can be minimized by combining with the potassium sparing diuretics like spironolactone. So spironolactone here is a potassium sparing diuretic, and furosemide can result in a hypokalemia. So this hypokalemia you can prevent by combining it with the spironolactone. Now another advantage of FDC is improved compliance. So patient is required to consume less tablets, and that will result in better compliance. For example, we have already seen isoniazid plus rifampicin plus pyrazinamide, which is prescribed in the treatment of the tuberculosis. So it improves the compliance of the patient. So these are the advantages of the fixed dose combination. Now let us discuss about the limitations or disadvantages of the FDC. So first major disadvantage of FDC is you are combining two or more drugs together in a single formulation, and that can result in polypharmacy or overprescribing to the patient. For fever or pain, you can prescribe either paracetamol or ibuprofen, and these are usually adequate. But when you combine these two drugs for the treatment of the fever or pain, it can increase the risk of the gastrointestinal side effects like mucosal injury, and it can also result in renal adverse effects. Now, another disadvantage of FDC or limitation of FDC is you must match the pharmacokinetic properties of all the drugs you want to combine in the FDC. For example, doses of one drug cannot be altered without altering that of the others. So, drugs with the wide dose range, for example, calcium channel blockers, which is adjusted according to the clinical response when you are using it for the treatment of hypertension, that you cannot combine with the drug which is having a narrow range. So this is another limitation of FDC. Another pharmacokinetic parameter is drugs with the different plasma half-lives. They may require different dosing intervals. So duration of the action of the drugs, if they are different, then you cannot combine. Duration of action of each drug must match with each other, then only you can combine it in the FDC and you can prescribe it to the patient. Another major limitation is doses adjustment. In FDC, dose of the any one drug cannot be adjusted independently. So FDCs in acute conditions before knowing the total requirement of the patient is not advisable, for example in case of hypertension. So dose adjustment is not possible in case of FDC. Now another limitation of FDC is adverse effects and drug interactions. When you are prescribing the FDC, you are exposing the patient to more than one drug, and that also increases the risk of adverse effects. If by chance patient develops any type of adverse effects, then identification of the drug which is responsible for this adverse effect, it often becomes difficult. So this is also one of the major disadvantage of FDC. For example, diclofenac, which is combined with the serotropeptidase, this combination is having no advantage over the individual drugs, and this increases the risk of the GI irritation, serious bleeding from unsuspected peptic ulceration. Now another example is norfloxacin or ciprofloxacin, which is commonly combined with the metronidazole for the treatment of bacterial diarrhea and amoebic dysentery, which is a kind of mixed infection, and this type of the mixed infection is very uncommon. So this type of the combination you should not prescribe to the patient. Another important thing is frequency of administration of these drugs also does not match. Unnecessary use of two antibiotics can result in resistant strains of organism. So these are the reason why you should not use this combination. There are so many FDCs which are available in the market. They are irrational. For example, two NSAIDs together or multivitamins together or two antibiotics together without having any superior efficacy in combination. So NSAID combinations, they are having no synergistic action or no improvement in the efficacy as this acts on the same enzyme, and it also adds to the cost of the therapy and adverse effects. So this type of the combination you should avoid. And last but not the least disadvantage is cost. Cost of the formulation may be increased because of the addition of two or more ingredients, and most of the branded FDCs, they tend to have higher cost, and that can result in burden to the patient. So these are the limitations or disadvantages of the fixed dose combinations. So in today's class we have discussed what is FDC, what are the criteria to prescribe FDC to the patient, and what are the advantages and disadvantages. Now let us summarize about today's video. Advantages and disadvantages of the FDC you can remember with the help of very easy mnemonic, and the mnemonic for the advantage is CART. So C stands for compliance. It improves the compliance of the patient. Then A stands for additive effect or synergistic action of the drug. R stands for resistance prevention. For example, in case of the tuberculosis, HIV or malaria, where the combination of the drugs are given to prevent the resistance, T stands for treatment regimen is simplified for the patient, as less number of the tablet patient has to take, so that will simplify the treatment. So you can remember the advantage with the help of very easy mnemonic, and that is CART. Now let us discuss about the disadvantages, and that you can remember with the help of DART. So this is the mnemonic. D stands for you cannot adjust the dose of individual drug in FDC. A stands for ADR. If it happens, then it is difficult to identify which drug has caused this. R stands for risk of the drug interaction or polypharmacy or overprescribing to the patient, because sometimes in FDC there are so many drugs that you may not be able to remember, and you may unnecessarily add on the other drug which may be present in the FDC, and that way you can also result in polypharmacy and risk of the drug-drug interactions. T stands for therapy cannot be individualized, or you cannot stop one drug. So these are the advantages and disadvantages of the FDC with the help of very easy mnemonics. If you like this video, then subscribe my channel and follow for more such pharmacology related videos. Thank you.